That's right. Well, it's a picture across London, but in particular, the bigger trusts are having the bigger problems. So we have Barts Health, which is the biggest, not just in London, but the entire country. We have Imperial College, which is over in West London, the Royal Free in North London, and St George's Healthcare, which is down in Tooting and in Roehampton. And what they are saying is that they've got vacancy rates of around 1 in 5 nurses and midwives are missing. So there's thousands absent across the capital, and this is having a direct impact on the services they can provide. So it means that they're having to close wards, close beds, and close operating theatres, particularly at Barts. St Bartholomew's Hospital is probably the worst affected, where there's a new heart centre that can't operate to maximum capacity because of the shortages. But also places like Newham Hospital and at Whipps Cross, where there have been problems with maternity due to the shortage of midwives.
No doubt there is an issue here, but Barts Health tried to perhaps dampen it down slightly by suggesting that because they are so big as a trust, that's why they have so many vacancies.
That's right, because they say these numbers are alarming, but remember, we do have a staff force normally of about 16,000 workers in total, not all nurses. They should have about 6,000 nurses and midwives, and they're short of about 1,200. So it's a big number, but they're a big organisation. However, the reality is that the important thing to stress, and they're saying, is that it's not meaning that the care is unsafe, because after the mid-staffs hospital scandal, what happened was that new nursing ratios were brought in across NHS. So basically it means that hospitals now can't open beds and wards if they don't have enough nurses to look after the patients. And that's what's happened here at Barts.
And there is the drive to try and get nurses from abroad here, and I believe at least one trust trying to get nurses in from the Philippines, but they're struggling at this stage to get them over here and actually working.
That's right. Barts is trying to get 44 nurses to the heart centre from the Philippines. It says that all the hassle with visas and so on means that it might only get 20 in the end. You know, they're also looking at Italy, at Spain and Portugal and Ireland. So there's a real worldwide search for nurses. It's easier within the EU, but there's essentially a pressing need to get them now, certainly before the student nurses come out of London in September.
Yeah, looking further afield as well, it takes a while for us to train nurses, and if it gets to the stage where we have new proposals or the suggestion that actually people who come to work here have to earn a certain amount of money, this could only make this situation worse.
That's right. Well, there was this idea floated that if a nurse didn't earn £35,000 a year, then they may not be allowed to remain in the country. That could catch a number of workers from the Philippines, especially because when they come here, and if they're not fully registered, they can only work as healthcare assistants and therefore get a lower salary. What Barts says, their chief nurse spoke to me about this yesterday, and she said, that's not really realistic. We desperately need these people. Playing around with the rules there isn't going to help anybody, because it would only mean there'd be fewer nurses available on wards. So I think they really hope that rule on salaries won't apply in reality to the NHS, and somebody in the department will see sense.
Yeah, OK.